So the strategies I adopted to help achieve these student goals included focusing on the most used topics and principles and the most common disorders, and to try to do those in sufficient depth that the students really mastered the jargon and the concepts. And one way that I did that was to sequence the teaching of the principles of organ function, followed by the clinical applications immediately. So, for example, we all really take for granted, as you sit there, just take a deep breath in and then just let it slowly out. And then think about the numbers of thousands of branching airways getting narrower and narrower in your lungs, representing airway resistance. But we never think about airway resistance when we're just breathing smoothly and easily. But when we see a patient coming in the throes of an asthma attack, and they are having such a difficult time breathing, we know that airway resistance is greatly compromised. So if we hone in on that principle that normal lungs have low airway resistance, then we can talk about diseases in which that normal function is disrupted. And that helps to reinforce the original principle, as well as making it clear why the disease process makes such a difference to the patient's homeostasis. So that sequencing you'll see another example of in a minute. And finally, it's so important to cover these tough topics that are really shaping our care now more than ever: genetics, immunology, neurobiology, that are impacting the care that we give.